Bismillahirrahmanirrahim. Assalatu wassalamu ala rahmatullahi alameen. Assalamu alaikum. I pray you're in best of health and spirits. In the previous videos, we were talking about hypertension, secondary hypertension, persistent hypertension. So I just thought to have a quick overview, yet comprehensive, about blood pressure and its regulation. So as all of you would be knowing, blood pressure means the pressure exerted by the blood on the wall of a blood vessel. However, mathematically, BP is equal to the arterial blood pressure is equal to cardiac output into systemic vascular resistance. So mathematically, you can say that pressure is the pressure exerted by the blood on the wall of arterial or on the wall of arteries, which is mandatory to maintain tissue perfusion, and it is regulated by these factors: cardiac output and systemic vascular resistance. Now, cardiac output mathematically is equal to heart rate into stroke volume. Heart rate into stroke volume. So now, from here, you can understand that there are three primary factors that regulate the blood pressure: heart, volume means blood volume, and this is basically the resistance to the arterioles or arteries, which have smooth muscle and they can constrict or dilate. So when they constrict, the resistance would be more, R, and when dilate, the resistance would be less. So if there is more resistance, the pressure would be more, and if the resistance is less, the pressure would be less. So now the heart, of course, also plays an important role. Indirectly, of course, you can say, but as the third point here you can see is baroreceptors. So basically, baroreceptors are located in two sites inside the body. The first is carotid sinus, and the second one aortic arch. So in acute conditions, or you can say for a very short time period, like in seconds or in minutes, the blood pressure is regulated by these baroreceptors. They have the nerve endings of two cranial nerves. The carotid sinus, you can remember from sinus S, CN9, aortic arch, CN10. So basically, in terms of here, the baroreceptors, the cranial nerves are involved, and they are known as stretch receptors, the stretch receptors. So if the pressure is more, so they would fire more, and they would want the heart rate to decrease and the pressure to slightly decrease. And this is through the parasympathetic nervous system. So of course, the autonomic nervous system is usually regulating here, this part. So the sympathetic, of course, if it's firing more, so the contractility would be more, the heart rate would be more. And on the contrary, if parasympathetic nerve fibers are firing more, so they would want to decrease the heart rate and or slight effect on contractility. So of course, if heart rate is increased or decreased, it would indirectly affect the blood pressure. So carotid sinus, aortic arch, they have stretch receptors, and the cranial nerve 9 and 10 are involved, which have a direct action on the CNS and then through the cranial nerves on the heart. Okay. So this was about the baroreceptors. Now the second one, so here this is short-term regulation, seconds to minutes. Now we would have maybe minutes to hours, and in here RAAS. So RAAS system is important. So if there is a decreased sodium supply at the distal convoluted tubule in the nephron, or decreased blood pressure, so renin would be secreted. Renin. Then renin would convert angiotensinogen into angiotensin 1. Okay. So angiotensinogen is a protein which is synthesized by the liver. Now angiotensin 1 would go to the lungs, and there's an enzyme called angiotensin 1 converting enzyme, ACE, also known as ACE. And angiotensin 2 is produced. Now, angiotensin 2 is a very potent vasoconstrictor, as well as it causes the secretion of aldosterone, 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 and aldosterone, of course, it upregulates the sodium potassium ATPase pump inside the nephron, and there is increased sodium reabsorption. So if there is more sodium reabsorption, remember, whenever there is more sodium, water follows sodium. So there will be more water also reabsorbed, and the blood volume will be increased. So it has dual effect here. The blood volume is increasing, so the preload would be increased and the stroke volume would be increased. And here vasoconstriction would have increased resistance and more pressure. So this dual effect would also want to increase the blood pressure. So this is intermediate regulation of the blood pressure through RAAS system, renin, angiotensin 2, aldosterone system, RAAS. It's very, very important. So in terms of pathophysiology and in any medical license examination. And the last one here, of course, is antidiuretic hormone, but the long term. So this was short term, intermediate, and the last through other hormones, through aldosterone, through ADH, actually kidney. So the last one, which regulates in long term, maybe hours, days, weeks, it depends on the underlying condition. So for example, if there is heart failure, the heart is not pumping adequately, so blood would not be reaching kidneys adequately, renin would be secreting, and this system would be activated, and it would take, why? Because actually the underlying cause is heart failure. If you treat the heart failure, this would automatically be regulated. So kidney is long term, and it has this effect of regulating water regulation, of course, water input and output, or you can say the regulation of water, blood volume, and hence the blood pressure. So this is antidiuretic hormone, which is secreted by the posterior pituitary when there is also a decreased, for example, there's dehydration or decreased blood pressure. So this would be secreted, and it's anti-diuresis. It means it would want more water to be reabsorbed through the kidneys, so that blood volume would be increased and blood pressure would be increased. Okay. So once again, this is a nutshell, you can say, this equation which helps you to understand the regulation of blood pressure, and it is regulated basically through the baroreceptors, short term through RAAS system, intermediate, and through kidneys in the long term, indirectly through the hormones such as aldosterone, ADH, and angiotensin 2. Okay, so thank you for watching, and if there is any questions, anything, you can let me know. So this was a quick overview of the blood pressure and circulation.